Press briefing. On the stage, we have two doctors, Dr. Zhang Shukun, Head of Communicable Disease Branch, Center for Health Protection, and Dr. Sarah Ho, Chief Manager of Hospital Authority. Dr. Zhang and Dr. Ho will respectively give you an update of the COVID situation. We start with Dr. Zhang. Good afternoon. As of yesterday, we recorded 1,522 local positive cases, including 559 directly tested positive via PCR, and also 963 positive RAT cases successfully confirmed via PCR. We have 128 imported cases, including 93 PCR positive cases, and also 35 RAT positive cases. So cumulatively, we have so far recorded 1.2 million cases since the start of the fifth wave. The hospital authority reported one more death case today. Altogether, from the hospital authority, we have recorded 9,107 cases. And the cumulative figure is 9,185 since the start of the fifth wave, including 3,791 females and 5,394 males. I will invite the HA representative to give you an update of hospital admission. We have 513 patients in our hospital system. We have recorded 76 among them being new cases. As for those requiring isolation, we have 167 in isolation wards, 13 in the second-tier wards, and also 141 patients now receiving treatment at North Lantau Hospital Hong Kong Infectious Control Center. 61 of them are new cases. As of yesterday, we did not record any new critical or serious cases. Among the inpatients, there are 10 patients in critical conditions and 10 in serious conditions. 3 in critical condition are receiving treatment in the ICU. In relation to the newly infected patients, we found that they are in stable condition with mild symptoms. In relation to admission figures, the number has increased comparing to a few weeks ago. However, those requiring isolation and those in critical or serious condition, we have not registered a substantial increase. So far, the situation remains stable. Yesterday, we reported the passing away of a 80-year-old male. He didn't live in a home. He had 2 COVID jabs, and he suffered from hypertension, cardiac disease, and coronary disease, and he also had an operation last year. He also suffered a stroke before, and also renal impairment. When he was admitted to hospital, he was found to be unconscious, and resuscitation was administered. And at the A&E unit, from the ECG, we found abnormality. And then upon further examination, we found, as far as the enzyme level of his heart was concerned, that the level increased substantially. So this might have to do with his heart disease condition. The case has now been referred to the coroner's court for further examination. I'll now give the floor to Dr. Zhang. Of the 128 imported cases recorded today, 48 were picked up at the airport, including 41 cases arriving on the 22nd and also 7 cases arriving on the 21st. 63 cases were picked up in quarantine hotels, and 17 cases were picked up after they've left the quarantine hotels with high CT values. And with a number of them having low CT values, these might have been local cases because of the community activities in the communities. For residential care homes, we received reports from 4 RCGs, respectively reporting 1 case involving 2 staff and 2 residents, including in Chun Wan, Heng Lam, Wu Lou Yun, Heng Lam Nursing Home. 1 staff member has been infected, and 2 residents will be sent to quarantine. And also, Tonghua Group of Hospitals, Elderly Home in Tai Po, and involving 1 resident, and 5 other residents will be sent to quarantine as they are close contacts. The Salvation Army Namsan Home for the Elderly, again, 1 staff member has been infected. No close contacts been identified. For Zhugyuan Wuliyuan, there is 1 resident involved, and 7 other close contacts will be sent to quarantine. For schools, we recorded 172 positive cases, and 95 of them tested positive this morning. 77 others tested positive either yesterday afternoon or earlier. Among the 172 cases, they involve 135 students and 37 teachers from 155 schools, including 24 kindergartens, child centers, 73 primary schools, 57 from secondary schools, and also 13 from special schools. In the past 7 days, 77 schools recorded more than 2 cases in the past 7 days. And we have advised the following the class of the school to suspend for a week, and that is Class 6C of St. Joseph English Primary School. There are 3 cases recorded in the past 7 days. For 6C, altogether there are 27 students. We have recommended class suspension for a week. For classes facing suspension, and that is St. Francis Xavier School in Chunwan, the basketball team is now under quarantine, and we've identified an additional case in the team, and there is also another case who is a close contact of a team member. So altogether, we've recorded 11 cases of the basketball team and 1 close contact. As for subvariants, today we have recorded 38 cases suspected to be BA.2.12.1, that is the Omicron strain. 14 cases matched the gene sequencing cases of K1 primary school, also suspected to be BA.2.12.1. 2 family members are involved. There is also a 3-person household in Mangon House in Daihangsai Estate, and these are untraceable cases for the time being. Yesterday, we mentioned YG Christian Service Changkwano Integrated Rehabilitation Services Center, in which a staff member has been infected, and again, this is suspected to be a BA.2.12.1 case. And so far for this center, we have not identified other cases. There are 5 other untraceable cases, 1 living in Futai Estate, Kwantai House in Tuen Mun. Second, in the Shek Wai Kok Estate, Shek Wan House, and Kwai Chung Ho Ging Tai Block 4, and Ying Hai Chun on the Ma On San, and also Tin Sum Village in Yuen Long. And there are also 25 other cases suspected to be related to a restaurant involving 24 patrons and 1 family member who did not visit this restaurant. This is in 3rd floor, shop 312 卓爾居, the Harbour Restaurant or Hai Gong Zhou Lou in Tuen Mun. For the cases, they visited the restaurant on the 16th of June and had dinner after 6 p.m. And between 18th and 20th of June, they began to have onsets of symptoms and then tested positive. We also recorded 2 cases in Hing Tai House, Tai Hing Estate, reported yesterday, belonging to BA.2.12.1. They also visited the same restaurant in the same time period mentioned. So altogether, this cluster involves 26 patrons and 1 close contact. Our colleagues, together with FEHD and EMSD representatives, are now at the restaurant to conduct site inspection. That concludes my report.
70 patients recovered, 58 discharged. Since the 5th wave, 51,467 patients recovered, 51,086 of them have been discharged. Since the beginning of 2020 in Hong Kong, altogether 63,847 patients recovered. 63,466 were discharged. And then 4 patients were found to be positive in their test upon screening, upon admission, or within the hospital. 4 patients are close contacts. For staff, 23,985 members have been found positive, and 23,812 have already reported duty again. Now we open the floor to questions. Please wait for the mic to be handed over to you, and please identify your media organization. The reporter in green. Good afternoon. I'm from Hong Kong 01. First of all, regarding the Sunrise Diagnostic Company, what is the outcome of the investigation? In relation to the Hong Kong-Zhuhai-Macau bridge, from time to time, cases were found to be uncertain. What has happened and whether there will be any penalties on the company involved? For Mr. John Lee, the CE-elect, has said that he would consider the possibility of reducing the number of days that travelers coming back to Hong Kong to stay in quarantine hotels or even home quarantine. It is said that 7 days would be effective to stop the infection being spread to the community. Reducing the number of days of quarantine, would that have an impact on the spread of the infection? I understand that there have been a few cases of BA.5.1. Well, for the Sunrise Diagnostic, I think there were 3 positive cases reported. 2 upon rechecking were found to be negative. The other one awaiting further investigation. We issued a press release yesterday. We will take up the matter with Sunrise again. As to the inbound travelers arrangements, I don't have the details, but I believe that there will be some risk assessment, and I'm sure there will be a balancing act between the risk of spread of the infection as well as facilitating the travelers. I think you were referring to the Macau case, BA.5. Sorry, speaker is off mic. No, regarding our cases, we found them. There is BA.5 cases were found at the airport. We couldn't identify the source. They worked at the airport. So I believe that it has to do with the location. There's the airport, or they got infected at their workplace, because the workplace is a high-risk area. Other than that, we haven't found other cases. The lady here, I'm from Phoenix TV. Recently, monkeypox has been found all around the world. They are quite prevalent in Europe. We have already resumed the flights from Europe. It is said that they will come to Hong Kong sooner or later. What is your assessment about the importation of monkeypox cases into Hong Kong? Do you have any preventive measures? I think Hong Kong government did talk about some preparatory work against the infection. Can you give us the details? Well, for our neighboring places like Singapore and Korea, I think they have already been notified of imported cases because it has got quite a long incubation period. And then our flights come from different places. It is normal to get imported cases of monkeypox. According to the World Health Organization or other health authorities, I think we are talking about infection or transmission via close contacts. The government has got a contingency plan. Of course, the easiest would be that it is a reportable disease or notifiable disease. When it is a confirmation, then the person involved has to be isolated and the close contacts have to be quarantined. Yes, the lady over there. Thank you. I'm from Now TV. Good afternoon, doctors. Just now, regarding the Victoria Harbour restaurant, can you tell us more about that cluster? They took off their masks when they were eating. Any other characteristics about the cluster, and what about the ventilation? Can you elaborate on that? And then for the cluster concerning St. Francis Xavier's, or rather in relation to the WeNet Club cluster. More details, please. Well, for the Victoria Harbour restaurant, we have to wait for the findings of the relevant departments before I can tell you about the ventilation. I think there were a few groups of them. We have yet to find out more about the details. Some told us that they were sitting in the middle, others were further inside, so they might not be sitting together. As to the case of the WeNet Club, let me take a look. That's in relation to the day center, right? I think we have got, I think altogether 5 staff members and 5 participants have now been confirmed. And then for people related to this place have to be tested compulsorily. And then the day center has suspended its operation. Currently, we haven't got other additional cases pertaining to this center. The one at the back. I'm from cable TV. If I may follow up on this, that is yesterday, it was said that we have got a few cases of BA.4, BA.5 being suspected as the subvariant for the airport worker. Can you give us an update? And is it possible that it will be transmitted in the community? And then for the Chinese restaurant, how many customers were there? And do you know about the spread of the tables or the distribution of the tables? Well, I think 7 or 8 families were having a meal at that place. Some were in small groups, just on his or her own, or in a group of 2. Others were of a larger group. We have yet to confirm. I do not have the information of the distribution of the tables. Today, we are going to issue a compulsory testing notice for those visiting the place after 6 p.m. on the 16th of June. They have to undergo compulsory testing. We are going to get the information concerning the vaccine passes from the restaurant, and then we can find out how many people would have to be tested on a compulsory basis. Well, yesterday it was said that the case was suspected to be either BA.4 or BA.5. His colleagues were subject to very frequent and stringent testing mechanisms, say, for example, RAT, etc. And that's why we're able to uncover this case. We haven't got other cases so far. TVB. Well, for this week, what about the trend of the infection? This is the 9th day that we have got more than 1,000 cases. What is the assessment of the CHP? Is it out of control or still under control? Another point is still about the Victoria Harbour restaurant. 25 cases. Is it because it was spread by the person carrying the subvariant, or is it a case of a cluster? And then in relation to Sunrise Diagnostic company, many people were sort of having a test there, and then many were found to be positive or uncertain. At the end of the day, upon rechecking, 12 only were positive. I want to know what is the latest position. How many were still found to be positive upon rechecking? And what was the total number of tests? And are you sure that at the time there was an environmental contamination?
Yes.
In relation to positive cases, indeed, the number is on the rise. The increasing trend is within our expectation. Most importantly, we need to keep track of the admission figures, the number of severe cases and the death cases. And the hospital authority has already reported on these figures. Despite a slight increase in hospital admission figures, we need to consider the proportion. At the moment, the proportion of death and serious cases is still on the low side. As for the route of transmission for the restaurant cluster, we are not sure yet because these cases involve the subvariant BA.2.12.1 as for the source of infection, we need to test all the cases which have visited the restaurant to see if we could trace the source. As for Sunrise Diagnostics, according to information we have, the 3 cases testing positive yesterday. Upon confirmation, it's found that the 2 are negative and 1 is indeterminate. So far at this moment, we have not recorded any positive case. Next question, AM 730, about Sunrise Diagnostics, about the 3 cases. Upon confirmation, 2 cases test negative and 1 case is indeterminate. Has it to do with the way the specimens were collected or contamination in the lab? According to Dr. Hong Pak Lau, there are 3 cases of BA.5.1 in Hong Kong, and Dr. Zhang, you previously said that there are BA.5 cases in Hong Kong. Are they these cases? And is there any major difference in terms of a clinical diagnosis and the routes of transmission for the 26 cases of Victoria Harbour restaurant? It said that they started visiting the restaurant at 6 p.m. until what time? And for the cluster, what is the earliest date on which the case is identified? Is it possible that the announcement has been made a day or 2 late? We previously picked up a case involving a staff working at the airport, and yesterday we recorded another case working at the air freight terminal, and this case may not be BA.5. Analysis is pending. And for Regala Sky City Hotel previously, we also recorded a case working at the hotel carrying BA.5, and some family members have been infected as well. 3 staff members, in fact, have tested positive. These are the cases we have. As for BA.5 cases, I'm not sure whether they are BA.5.1 cases. I think the microbiologists and experts can conduct further analysis whether they belong to the substrain BA.5 or BA.5.1. At the time, we were not aware of the classification in Macau, and we did not take note of that. But according to WHO and other disease control centers around the world, for BA.5, BA.4, and BA.2.1, these are also subvariants of Omicron. And according to literature, these have higher level of transmissibility comparing to BA.2.2 or BA.1. But in terms of severe cases, death cases, or repositive reinfections, there is no evidence to suggest that these subvariants are more serious than the Omicron virus. So the common factor is high transmissibility. And we are still looking at whether there are differences with the BA.2.2 subvariant. Last question from this lady. I'm from Ming Pao. First question for Dr. Zhang. You mentioned Victoria Harbour Restaurant. Are there 25 or 26 cases? Are staff members involved? And have you checked with all the patrons there? And also about Wai Chi Christian Service Chung Kwan O Integrated Rehabilitation Services Center. There is a case of BA.2.12.1. Is that a residential care home? Can you tell us more about the residents, their age profile, etc.? Third question, for the Macau Authority, they've mentioned BA.5.1. Do you have any idea whether there are residents or visitors coming from Macau via return to Hong Kong or come to Hong Kong and later identified as community infections? And also for the FedEx case reported yesterday, do you know if there is any correlation with other imported cases? Is it possible that transmission took place via goods? And about bar clusters, we haven't heard of any new clusters nowadays. Is it because you no longer announce the result of contact tracing for bar patrons? Now for Victoria Harbour Restaurant today, we have recorded 25 suspected cases involving 24 patients and 1 family member. As for BA.2.12.1 reported yesterday, two live in Heng Tai House of in Tuen Mun, and they also visited the Victoria Harbour restaurant at the same time, so they are related cases. Now, as for preliminary gene sequencing, we could do it swiftly because mostly we focus on L452. If it's L452Q, then the case is suspected to have BA.2.12.1. However, time is needed for collecting specimen and for the actual testing. They had dinner on the 16th of June, and these cases mostly started to exhibit symptoms on the 18th to 20th, and that is followed by collection of a specimen. So that's the chronology. About BA.2.12.1, this suspected case belongs to the YG Christian Service Integrated Rehabilitation Services Center. It's a center for the severely handicapped persons. So far, we have not identified new cases, and the close contacts have been sent to quarantine. I don't have information about the age profile here. And we have not recorded any imported cases from Macau so far. And in fact, recently, we have not identified any imported cases relating to Macau. The speaker is not coming through. Yes, if there are major outbreaks, this will be done. For FedEx, we have not received the new cases. The speaker is not coming through. There are indeterminate cases. We are conducting a review. So far, no positive case has been identified. That's the end of today's briefing. Thank you.